Hi, my friends. Hello, everyone. How are you? Well, I'm living my day offs after almost 1 month inside nursing home, working in one temporary work to be a substitute, to in substitution employee. One employee was out because COVID-19 positive result. So I was there in this situation in a temporary contract, and I was there to treat the elder persons, the most of them COVID-19 positive too. In abstract, I would like to share this information with you because especially Dr. Tedros and other authorities in the world, because it was a nursing home. And about nursing homes, yes, I can talk right now because I am a nurse. I was there, and it's very important to be in the land to feel the problems, to feel the challenge, and to find the solutions. Okay, first of all, we are talking about this situation. Okay, the map, global global map. I have all this map in my room because to remember this is a pandemic, and of course you can observe the reality and learn with their reality, or you can deny the reality and stop to do theorizations and to find magic information. Okay. I was there in a nursing home. I was a worker there, and I feel the challenge. I felt the challenge. First of all, nobody knew me. I was really new there, and they didn't know nothing about me, that I am a specialist, an expert in nursing and public health and epidemiology, and they didn't know I have more than 12,000 hours of experience and more than 7,000 hours of formation, education in nursing and public health, epidemiology, and sciences, and philosophy and education. So I am almost uh, 20,000 hours distant from them. And uh, do you imagine it, how I could be there and feel the situation without develop any kind of prejudice? Okay, um, they they were all the time evaluating me because of course they didn't know about nothing about me, and they are very scared about the elders, the persons, and of course they didn't know I was the best person in the world he could achieve in that moment. Well, I was responsible for 12 to 22 persons per day. Do you believe it? It's like a war. I understand. In this moment, I was, of course, I was alone with 12 persons, 12 patients, or 15 patients alone, or I have a colleague without zero experience in health. no experience, was contracted only she and after he, a man, a woman and a man, was my partners to help me, because I told you, babies, it's impossible. And of course, you feel like in nursing homes you have to feed person, like to offer to elders food, medication, hygiene, to go with them to bathroom, and um, to help them to go to pleasures areas like television area, etc. So it's like and between parents, these are a simple action, and so a person without formation but with the correct orientation could do this type of work. But this is a problem. We are talking with people with a contagious disease, COVID-19. So, in fact, all persons inside the nursing homes need formation right now, rapidly in the world, because for them, the most of them have the employees have no formation in health, and it's a real challenge for everybody. I could feel the fear they felt. They are because of course they were afraid to be contaminated, to have COVID-19, to return to their homes, a lot of problems. So they need formation right now. Of course, it's really, really important. Okay. I was there. This type of work, the patients, the elders, they have complications, COVID-19 complications, like headache, weakness, pain, diarrhea, vomits, risk for falls, risk for less hydration they need, or because they don't have appetite and they started other type of imbalance, food and water imbalances, and of course other types of problem, pre-existent conditions like diabetes, blood arterial alterations, um, um, uh, disease, cardiac disease, heart diseases, and of course Alzheimer and neurological conditions. So it was a problem too, because about COVID-19 you need to explain the people, in this case to elders, they have the disease and they need the isolation, and it's very difficult to explain to someone, for example, don't have a good ear to listen the information, or have neurological problems to understand the information or to accept the information. So this is the kind of problem we have in nursing homes. How to explain the person, she or he needs to go out that room, to go out to other room with inside the isolation area, because she or he has the virus, etc. So it's not so easy. I observed many situations, stressful situations, because this type of when they were communicated or they were transferred to other places, and yes, it's very difficult to handle this situation. So, you know, we have a lot of research in nursing area. The best practices we can have and we can offer to elders, to children, to patients, to in acute or in chronic diseases. It's like 5 persons. So the best rate nurse and nurse or nursing assistant or auxiliary, what kind of name you have inside the nursing home, the best situation is 5 persons to care. If you have more than this, you probably you have difficult to handle the situations, because all of them were demanding attention, really important and attention. You know me, a lot of time, you know, I am like, oh, the kind nurse in the all the time, but yes, they needed to wait for my attention, so I needed to be with each person one time. And it is really stressful to the other to wait when. Okay, so we need to think about the things, how to handle this shortage of personnel inside the nursing homes, how to handle, train the people. Is not enough. How to handle, maybe how other strategies to help, like volunteers or training faster persons to be to a specific treatments to help, really help what they need. And of course you need nurses and doctors with experience every day inside the nursing homes, to observe the risks, to do exams, and for example blood exams, collect these blood exams, and or urine, of course, any other simple exams, to offer to laboratory and receive the results. And this is elders cannot needed to could not be transferred to a hospital, because hospitals are very crowded, and in this way the nursing homes will be transformed in the local system, the first level of health system. Okay, this is the importance right now. Transform and understand nursing homes as a health unit, and integrate the nursing homes inside the health system right now everywhere. Offer then the training to the employees, and integrate with the authorities, epidemiology authorities, and right now offer the vaccines to employees and elders. So it's the simple information. Hope you are healthy and well everywhere. Love you. Bye bye, Dr. Tedros. Positive way, heart and mind.